So what does the road to recovery from a serious mental illness actually look like? It can feel like you're trying to navigate a huge, confusing maze without a map. Well, today, we're going to cut right through all that complexity. We're laying out a clear, step-by-step roadmap for schizophrenia, walking you through everything from diagnosis to medical care and long-term rehabilitation. And where are we getting this roadmap? Our guide for this whole explainer is the landmark manual, Surviving Schizophrenia by Dr. E. Fuller Torrey. We're zeroing in on the critical advice from chapters 7, 8, and 9. These chapters really lay out the practical steps for getting your footing, understanding the medical treatments, and most importantly, building a life in recovery. You know, this quote, which is featured in the book, just perfectly frames the challenge here. It's so powerful. The system itself can be incredibly difficult to navigate, which is exactly why having a clear map of the steps involved is so critical for both patients and their families. All right, so here's our game plan. We're going to break this journey down into 4 essential parts. First up, finding your footing, those crucial first steps. Then we'll look at the medical treatment options that are available. After that, we'll talk about the pillars of rehabilitation. And finally, we'll wrap up with a really important modern philosophy of care called the recovery model. So let's dive right in. Our journey begins with finding your footing. This is that critical first phase, which is covered in chapter 7 of the book, and it's all about building a solid foundation for everything else that's going to come next. And the book makes one thing absolutely crystal clear. Nothing, and I mean nothing, can happen without the right professional help. The very first hurdle is finding a skilled doctor who can do a thorough evaluation and give an accurate diagnosis. This one step literally sets the stage for the entire recovery journey. So what does a proper workup even look like? Well, it's a really comprehensive process. It's not just one conversation. It means taking a detailed medical history, doing physical and neurological exams to rule out other possible conditions, running lab tests, and pretty often it includes a brain scan, like a CT or an MRI, just to get the full picture. Now, sometimes hospitalization is the safest and most necessary step. This can happen in a couple of ways: through a voluntary admission, where a person agrees they need that level of care, or through involuntary commitment. That's a legal process for times when someone might be a danger to themselves or others and just can't make that decision safely on their own. But, getting a diagnosis is really just the beginning of the battle. Dr. Torrey points out this real-world maze that families have to get through, trying to find alternatives to the hospital, fighting for fair insurance coverage, and securing outpatient care. It's a really complex landscape, and it can be especially tough for children or for folks living in rural areas where there just aren't as many resources. Okay, let's move on to our second section. Once a diagnosis is in place, the focus shifts over to medical treatment, and this is all detailed in Chapter 8. These are really the tools that are used to manage the acute symptoms of the illness. The book asks a really fundamental question: do antipsychotic medications actually work? And the clear consensus is yes. Absolutely. Now, they're not a cure, but they are incredibly effective at reducing or even eliminating symptoms like hallucinations and delusions, and that makes it possible for all the other forms of therapy and rehabilitation to really take hold. These medications usually come in 2 main forms. You've got your daily oral pills, which, of course, rely on someone consistently taking them, but then there are also long-acting injections, which are only given every few weeks or even months. And honestly, this can be a total game changer. It removes that daily pressure of remembering to take a pill and provides this steady, reliable foundation for recovery. And the toolkit doesn't stop there. It gets more specialized. For cases that are resistant to other treatments, clozapine is often considered the gold standard. In really severe situations, ECT can be a life-saving intervention. And, crucially, medication is paired with therapies like psychotherapy and CBT to help people build the practical coping skills they need for everyday life. All right, on to our third section. After the acute symptoms are stabilized, that's when the long-term work really begins. Chapter 9 is all about rehabilitation. We're talking about the practical, real-world steps you need to take to rebuild a life. And this is where Dr. Torrey's advice gets so incredibly practical. The first pillar of rehabilitation, it isn't therapy, it isn't medication, it's money. Having access to financial support and basic necessities like food is the absolute non-negotiable foundation. I mean, think about it. Without that stability, how can anyone even have the mental space to begin the work of recovery? The second pillar is housing. A safe, stable, and supportive place to live is absolutely essential. This could be a group home, supported living, or living with family. But the real key here is consistency and security. It's all about moving away from the chaos of homelessness or unstable living situations. From there, we build to the next pillar, employment. And meaningful work is about so much more than just a paycheck. It provides a daily structure, it gives you a sense of purpose, and it's a really powerful way to reconnect with the community. And finally, there's friendship. This illness can be incredibly isolating, so things like social skills training and programs that help people rebuild relationships are just vital for combating that loneliness and creating a support network, which, as we all know, is a key part of a fulfilling life. So all of this brings us to our final section, and it really ties everything together. It's a modern philosophy that has totally reshaped the goals of treatment. It's called the recovery model. At its core, the recovery model is a really powerful shift in thinking. It's built on a simple truth. The more opportunities a person has for rehabilitation, things like stable housing, a job, and friends, the better their outcome is going to be. It's a model that's built on hope and possibility. And this represents such a fundamental shift in perspective. The goal is no longer just about reducing symptoms. The true aim of treatment today is to empower individuals to build a satisfying, hopeful, and contributing life, even with the challenges of the illness. And that leaves us with one final critical question. Understanding this roadmap is one thing, but what systemic changes in our healthcare, in our housing systems, and in employment are needed to make sure that everyone, and I mean everyone, has access to these pillars of rehabilitation so they can make recovery a true reality?